pleasure of introducing Joey Ridenour. And Joey, let me tell you a little story about Joey. Y'all know I've been in this position for 12 years, right? 12 years. And do you know that it's kind of a hard job? Do you know that you go into this position and you don't know anything? And so the National Council of State Boards of Nursing assigned me a mentor. Joey was not the mentor. But I talked with the CEO of National Council and I said, I need someone who is near me and who has a board somewhat like mine, who I can go and she can tell me all of the secrets that I need to know to do a really good job for Nevada. And they let me go visit Joey. And I really think that she was instrumental in putting me in a place where I was able to feel comfortable in this position. So thank you, Joey.
You're welcome.
Joey has been the executive director for the Arizona Board of Nursing for the last 19 years. She's a glutton for punishment. Prior to that time, she worked for 10 years as the VP of nursing in a 500-bed teaching hospital in Maricopa Integrated Health Systems. I'm going to put this down. She also worked for 15 years prior to that in other executive management positions. She spent 7 years on the board of directors for NCSBN, 4 years as their president. And in fact, was one of the people who I think was instrumental in luring Kathy Apple away from Nevada. She is a fellow of the American Academy of Nursing, and she has been had that designation now for 5 years. And she has served on the National Board of Directors for Nurse Family Partnership for 5 years. So I am so excited to welcome her and to have her speak to you today on evidence-based competencies for nursing leaders in the boardroom. Please help me welcome Jody.
Can you hear me okay? Is it coming through good? Well, thank you for inviting me up to Nevada. I'm delighted to be here and to share with you what I've been learning over the last 20 years, which is it's really about leadership in the boardroom, but it's also about what are those competencies if you're doing it very well. So what we're going to cover for the next hour, and I was told just before I got up here that I'm the only thing standing between you and a glass of wine, so I'm very aware. Can you hear me better? You can't hear me? Is this better? I'll hold it then. So over the next hour, we're going to go over 4 major areas. We're going to discuss the survey that was just compiled, but it's not been released yet, so you're going to see it before the state of Arizona sees it. And it has to do with nurses serving on boards. We're going to talk about a lot of competencies, more than 10. If you're effective in the role, what do you look like? I'm going to describe the differences between the board trustee roles, whether you're in a private, non-profit, or government position. And then identify some strategies for getting nurses on boards. So you've already had a well-prepared introduction to this, so I'm just going to tell you a lot of the work that I'm doing today centers around the recommendation 2, which is to provide opportunities for nurses to assume leadership positions and to serve as full partners in the healthcare redesign improvement efforts. So we've heard also earlier that today, as the largest population of healthcare workers in the country, we must be in these roles. We must not only be on boards, but we need to be sure that the nurses are represented on the executive team and that they're also in other key leadership positions, whether they be public, private, or governmental. So you also were shared today, that's one of the disadvantages when we don't know what each other is going to say. There was a Stout poll that was done in 2010 where 1,500 thought leaders, which came from organizations such as corporations, insurance companies, health services, government and higher education, had a chance to tell us what they were going to be projecting would happen in the next 5 to 10 years, who would influence the healthcare system reform the most. So they overwhelmingly stated that nurses should be able to influence more, but what did they say? They ranked them as the lowest individual to be influencing healthcare reform. So I'm applauding you for taking the leadership to make sure that does not happen. There was another survey that same year, in 2010, the American Hospital Association, where they asked over 1,000 hospitals, tell us about who was represented on your board. And we heard that number already. Nurses were only 6%, physicians were 20%. So what did the survey show that Arizona just completed? And again, it's not been released, as I mentioned, so they allowed me to share this information with you. And what we did in Arizona is we surveyed all the RN nurses in the state. So we asked them, do you currently serve on the board? And you remember the data from 2011, which was 3 years later, was 6%, and we're still 6% in Arizona. We've not improved in that area. How interested would you be in participating in activities to prepare you for a position? As you can see, highly interested and moderately interested is about 50%, and the others slightly or not interested at all is another 50%. How many years have you been licensed as a registered nurse? You can see the data there that 20% were more than 30 years. Less than 5 years was the 18%, as you can see, and all the other numbers there. Please select all the degrees or credentials that apply to you. I'm not sure what they're going to do with this information. I think it gives you a lot of background information, but it doesn't allow you to really understand what's the highest degree held. Which of the following activities would be helpful to you in preparing you to serve on the board of directors? And this is probably the slide that's going to be the information that they'll need to really develop a plan from. First one was identifying a board in which to serve. 1,672, or 63%, said that was important to them. Understanding what you have to offer. They need to understand that better than what they do now. General training, I think that was an area that you found too when you did your survey. And then mentoring was also important. Only 3% said they felt fully prepared to serve on a board at this point. Question they had too was question 8, do you want us to contact you to pursue how to prepare you to do it? And as you can see, it was a 50-50 on this one. 50% said yes and 50% said no. What currently describes the position that you hold in nursing? As you can see, the position at the highest level of leadership in the organization, such as a CNO, nurse manager or director of nursing, was the highest one. Middle management was 5% or 6%. And then providing direct care, as you can see there, was about 10%. Which of the following best describes the type of board that you serve on? As you can see, the hospital healthcare system, it was about 18%. The highest percentage of those was 33 individuals. Which of the following best describes your board appointment, how you obtain it? Were you appointed or were you elected? And you can see that the majority were either appointed or elected. And then a number of them were also volunteers. Please indicate which of the following would be most helpful to you in your board member role. Again, I think this is a part of the overall recommendations that will take the most work in strategizing. Mentoring was towards the bottom. I expected that to be a higher number than it was, 16%. But I think maximizing what you have to offer needs to be understood better. People need to be prepared in how to describe that. General training, again, is the highest, second highest number there, as well as mentoring, as I mentioned. Would you be willing to mentor? And again, Overwhelmingly, 60% said yes. So when you see the percentages, it doesn't always give you how many people are really interested. Out of the responses that were received was 4,305. It was very surprising after seeing those numbers that 257 are really serving on boards at this time. Those that are highly or moderately interested is almost 2,000, so there's a lot of work to be done. Are they willing to mentor someone? That's 125. But of all that, over 1,000 individuals want more information. They want to know how they can participate and or contribute. So I think the missing data, at least from the Arizona data, is we know that nurses have a clinical leadership competencies required to serve on these boards. They represent the highest population as far as in the healthcare organizations. And we know that they provide the majority of patient care. But what we don't know is what their stories are and what they believe is their advantage of being on the board, whether it be a board of health or whether it be some other high-level position. So I think that maybe there needs to be some new messaging in this. And I believe that nurses have firsthand insight into the views and concerns of patients, families, and communities, as well as expert knowledge on how to best achieve cost-effective quality care. And this insight has to be shared more attentively, more deliberately with individuals such as policymakers. So what are these three insight channels? The first one is that I believe that nurse execs have the ability to understand deviations from the norm, those anomalies. We have a lot of data in healthcare, and especially in the acute care settings, and I think they know how to pick up those anomalies. Then an ability to understand that then gives the information that there's more to be understood, and that's where I think they believe and they can contribute the highest level of insight. What's the second insight channel? I think that the nurse exec is able to pinpoint the deficiencies in the system. They pay attention to what the organizational processes or practices are that annoys either nurses or others. They understand what those workarounds are because they have to deal with them all the time. And they know that the organization learns most from those who are most intense about their compliance. So we call these pain points when you're in the delivery side. So knowing what those pain points are really gives you a terrific opportunity to understand what can be improved. I think the most important thing in the insight channel is they ask the question, why do things have to be this way? When something has been done for so long the same way, I think that's the person should be able to say, is there an alternative? Can it be done differently? As we all know, traditions often block the potential of innovations because people are reluctant to leave what they feel is tried and true. And as you've heard this afternoon, as the conditions change so much, we need to change all those traditions. So my journey on learning about governance really started about 20 years ago when there was really only one guru that talked about governance and what high-performing board members look like and high-performing organization looked like that had high-performing boards. And its name was John Carter. I don't know if you've read it, maybe it's past some point when you've gotten into the literature, but it's really evolved in the last 10 years. When you do a Google search now, there is so much information out there. No matter what level of interest that you have, whether it be understanding the governance models or understanding what does effective governance look like. And of course, I have this interest in regulatory boards at this point. But what I found and what I want to share with you is that no matter what type of board that you serve on, whether it be a profit, for-profit, nonprofit, governmental, which is regulatory, the principles are all the same. So let's start out with some standard definitions. What's the difference between stewardship and governance? When you're talking about being a steward of an organization, it means that you place the organization's interest above all special interest. That you do everything you decide on for the greater good. There's no personal agendas. When you're talking about governance, you're talking about how you're steering the organization. And it usually involves a lot of strategic planning, measuring outcomes, and a lot of fiduciary oversight. So no matter how you look at it, again, the governance principles are common across all the governmental, nonprofit, for-profit, and corporate sectors. Legal duties. And many times you hear about the competencies, but they have a legal responsibility also. The first responsibility is duty of care, which describes the level of competence expected of a board member. You have to have reasonable care in the decisions as a steward of the organization. And how do you do that? Very simple. You come to meetings prepared, you've read the materials. Important part is you participate and you ask constructive questions. You think it strategically. And of course you have the appropriate skills and experience. So there's a lot of homework typically when you do serve on a board. So the first legal responsibility is duty of care. The second one is duty of loyalty, that you faithfully act in the best interest of the organization, that you give undivided allegiance to all the decisions affecting how you're meeting the mission, you avoid conflicts of interest, and never use the information as a personal gain. The third legal responsibility has to do with duty of obedience. You act faithfully to carry out the mission of the organization. And you're not permitted to act in a way inconsistent with the central goals, because the public trusts the organization will manage the funds to fulfill the mission. So that's the three legal responsibilities. So what are some of the board competencies? And all this is found in the literature and some of those sites that I just referenced to you when I do the different searches. The first responsibility related to competencies has to do with determining and advancing the organizational mission and purposes. You're constantly thinking about that. One of the biggest jobs that I think any board has is to find, select, set the goals, and evaluate the performance of the CEO or the executive director, whatever their title is. And their assessment is usually measured against this strategic plan. Another competency of board members is to make sure there's adequate resources for the sake of the organizational health. And the resources are usually found in the funds that you have to run the organization, obviously staff, and information technology and all the parts. Most important thing that I think that competency about board members has to do about sustainability of the organization and making sure that you have the revenues and the funds to sustain in the long haul. What are the other competencies that you need to come with to be an effective board, a highly performing board member? You need to monitor and enhance the programs and services. For those of us in regulation, our programs typically have to do with the licensing process, the investigative process, and the review of the educational programs. Board member competencies also relate to ensuring that the organization is doing everything that's legal and ethical, make sure it maintains accountability. You also have a responsibility when you're a board member to continue to look for new board members and to assess the overall performance of the board. Additional competencies relate to making sure that you get the information you need to make the decisions, focus on results or outcomes as opposed to activities, and understand what your information needs are and just don't accept that people are giving you information. There needs to be a sound relationship with the external bodies or the stakeholders, as well as the members. Whatever the member purpose of the organization is, you have to have a sound relationship with the membership. And you need to manage risk effectively. The risks that some of us are dealing with the last couple of years have to do with data breaches, and you need to make sure the systems are in place to prevent that. Deb? Okay. Additional board competencies have to do with providing information to the public, such as your annual report where you're talking about your financial results, any audits that's happened, and then outreach activities and any strategic plan accomplishments that you would report out. Board member competencies also relate to making sure there's a sound governance process. Then again, that goes to the effective relationships with the staff, the collective and individual performance of board members, and always looking for the ethic of continuous improvement. There also is competencies related to the making sure that the chair is effective, or the president, whatever the title is. You to make sure that the committees, whatever they're charged with, are also effective in their role.
We can't hear you back here again. Sorry.
Okay. Sorry. I think that another area to competency is holding a microphone. I think that all of the board members have a responsibility for managing the board meetings effectively. It doesn't just live with the chair or the president. Another competency is to ensure there's a positive board culture where you're listening and respecting one another, and that you deal with conflict resolution, and that all board members feel that they're valued and offer constructive changes in how things need to be done. Other board competencies is to make sure that there's sufficient information and data provided in advance. And Kathy Trower, who is one of the more recent individuals that has a lot of evidence-based practices with highly performing boards, believes very strongly that you do not accept recommendations, but you ask people to bring options with pros and cons so an informed decision can be made. She believes that a recommendation by the staff is really a decision in disguise. And sometimes it is. So who else has information on what the primary role is and what some of those core competencies are? It's the Institute of Governance, and this came from 2009. And they just list 5 things. I just told you about 20, and they only have 5. Be prepared, attend, and participate in the meetings. Listen critically, express your views, share what experience you have, know what the board's obligations are, as we talked about the legal responsibilities, maintain confidentiality, and then once a decision is made, everybody supports it, no matter how the debate occurred at the time you got to the decision. The Institute also feels that the board chair or president's primary role is to guide, develop, and coordinate the work of the board. And this person does it by making sure good questions are asked, that the debate fosters collective wisdom so you get all the viewpoints out, that you lead people but you also restrain. Because sometimes those that tend to have the most to say are the ones that have to have some restraint. This person also needs to make sure that the individuals feel that they are developing the confidence they need to be a good, high-performing member of the board. And of course, the president needs to work very closely with the CEO or the ED. What's the primary role? If that's the chair of the board or the president of the board, what's the primary role of the executive director or the CEO? They're the central leadership and have the administrative authority in directing the operations. The board has the ultimate power, but the CEO has the immediate power, the day-to-day operations. The most important thing that the executive director or the CEO does is to engage the board to make sense of difficult situations, determine out of that difficult situation what matters, and then solve the dilemmas. So those are the core competencies of board members, stated in different ways. This is all found in the literature. It's nothing that I've been able just to tell you off the top of my head. So what do you have as far as access? Now you have someone who understands the roles and understand what those core competencies are. Where do you find the positions to place them on boards? I think that you can do it through increasing levels of volunteer work where you start on a committee or you go directly to the board. A second way is to think about some organizations, and again, you may already be representing these different organizations within Nevada, such as the American Cancer Society, the American Heart Association, Red Cross, and of course, boards of nursing. What you're doing today is beginning to do what you should be and getting, if you're not served on a board, beginning board ready, by educating yourself on what some of the practices are, what are some of the competencies, what are the roles and responsibilities. And I think that you shared that you had been through a course through Robert Wood Johnson on nurse leaders in the boardroom, the skills that you need to be successful on the board. I think one of the challenges Arizona is going to have is to develop the resources to assist the nurses to be appointed to these positions. They don't have a strategy on that yet, and you may have one. They're great for us to be able to share between the states. Maybe what you developed is something that we could also model after. I think another area as far as the strategies to increase nurse participation is to develop that relationship with the CEOs and board chairs in the support of nursing representation and dialoguing with them and helping understand that insight channel and how important that is. Using the current challenges to validate, I did this when I was the VP of Nursing, to provide the insight that other people don't have and understanding why perhaps not just a nurse exec, one nurse exec, but other people need to be from the nursing executive team on the board. Seventh way to develop a strategy for participation on boards is to develop pro-nursing attitudes with board members, such as maybe having rounds with the VP or the CNO of nursing, having an opportunity to share their insight again. Probably the biggest way that I think that maybe we can increase participation is really understanding some of those websites out there. Have some of you access different websites to see what's available for board positions? So the four I picked up was Board Net USA, Volunteer Match, Lincoln Volunteer Section, and All for Good. And I'm going to show you a little bit what's on our websites. When you look at Board Net USA, you see some of their data. And for you to be an individual that wants to log in or have a profile in it, it does not cost you anything, but it costs the organization who want to access these people to pay a certain amount to be within the group of people that have openings that nurses or anyone would want to participate in. So what BoardNet USA states, they have 12,000 candidates for nonprofit boards. Any one year when you look at how many board positions are really open, there's over 2 million. So this is really an area that you can explore to see. You can put in your zip code or you can put in your state and see what positions are available. Another one is called Volunteer Match. I didn't go in and put my name in any of these because I was concerned that I might get contacted. But you should play with it. And again, this particular website talked about they had 99,000 participating organizations and they had over 8 million matched. So this is, I think, a terrific way for you to try to figure out what's out there and what might you be interested in. And they had 92,000 volunteer opportunities. Another one is LinkedIn for volunteers, where you can explore the opportunities. And again, what they usually post is the position, what they're looking for, the leadership, governance, oversight, what you can expect if you do. And for any particular organization to make an application, what the fundraising requirements are, the board terms, and then what the qualifications are. Another website for volunteering, finding board positions is called All for Good. And what they look like is that you select the area that you wish to volunteer on, the dates that you're available, how close to the home you want it to be, and then your area of interest. So that gives you some insight as far as how do you perhaps begin a plan on how to begin maybe on a low level, participating on a board, and then having a long-term plan of being on a board as an executive nurse or related type of area. So what else may be a strategy to increase participation on boards? I think all of you need to know that all the organizations that seek members to be on their boards really do invest in your learning. And when I did a search on that, I found that about 3/4 of the organizations have an orientation process, whether they call it leadership orientation or may have different names. Many of them provide retreats Many of them sponsor you to attend conferences, over 50%. They have formal staff presentations to make sure that you understand the programs and services, and then also provide ongoing education at each of the board meetings. But I've only found 31% that really provided mentors. I think for those of you that may think, well, how long does this take to learn? When we looked at the literature on this and found an average board member takes about 6 months to feel confident and comfortable in contributing to that particular board. So that's a little bit more than a semester. So what are some of the better books out there? You saw thousands and thousands of potential resources. One of the books that I'd highly recommend that really addresses and is based on research, common denominators, critical to board performance, is a book put out at Board Source. And it's based on the expert advice and information from leaders who have been studying this area for over the last 30 years. One of the more recent ones released in the last 2 years, I think is the best one out there right now, and it's based on research again and evidence. It's by Kathy Trower. It's the Practitioner's Guide to Governance and Leadership. It's a phenomenal book. If anybody's seen this one or read it at this point, give it a shot. Very good. So, I did it very fast. We talked about what we found out in Arizona for the 2014 surveys that are still yet to be analyzed. You saw some of the raw data. We really talked about 20 competencies essential for nurse leaders in the boardroom. Provided you from some literature that states that there's no differences between the different boards, that the board competencies are the same, and board member competencies are the same. And we identified some strategies. So you know of individuals that would be appropriate to serve on boards can share those with them. So that's my information to be shared with you on board member competencies. I think that I would like to hear from you. Is there anything that you felt should have been on that list that wasn't, that you have experienced in your board experience? How many of you right now serve on Board of Health or some type of exhibit? Okay. Do you want to share a little bit with how did they prepare you to function in that role?
It's a board of nursing. So in the board of nursing, we do have members. So we're very careful our new members have. Can you please stand up? Sure, is the mic. In the board of nursing here, we do have mentors, and we pair up one person with another. And of course, we're very open, so if they want to talk to anybody on the board, they can come to me as president or any of that. National Council of State Boards of Nursing sends that book out by Trower to the new president to make sure that they have a good understanding of governance. It is an eye-opener because it's regulation. And so there are some things I think are different in that oftentimes we do not have a choice. We have to follow regulation. And sometimes they'll talk in boards about making this decision, that decision, and we're going, we don't have that call to make. But I think right now our board is highly functioning. We have a very strong executive director who does the day-to-day management that allows us to think about where the strategies would need to go. But it is a very different role. It's not just like being in a meeting. Especially if you're president, you now are responsible for the functioning of that board and all the outcomes that come from it. But it's very rewarding. But it is challenging for the first 6 months. So, does that help?
Other experiences?
I don't need the microphone. I had an experience of learning how to project my voice when my sons were teenagers. So let me say, I will have a couple of words about some of the things you said, but one of the things that I think hurts nurses from getting on boards is this idea that we do something like this. Well, I'm just a nurse. I don't know anything to be on the board. And I think we really have to work on that image of I'm a nurse. I coordinate care for groups of patients in the hospital. I can see the big picture, right? Much more attractive than, I'm just a nurse. I think that's one thing. I will tell you, as I progressed through my career, that I did learn that I have to speak at the meeting. Because typically, as a woman, you get into a board and it's 80% men, and they don't really expect you to, this is my impression, so these are my psychoses. They don't really think that you have anything intelligent to say. In fact, if you sit there and don't say anything intelligent, you confirm that for them. So I almost always, at least in the beginning of being on board, make sure that I read the materials and have a couple of comments that I can speak up and say. So that way it does two things. It shows, oh, she's actually prepared. She's not just a pretty face. They never really thought that. And secondly, oh, she makes a good point. We should consider that. So I would say that those types of things are really important for us in projecting ourselves, as potential board members. So those are my evidence.
Were your comments based on insight, or what were they?
Oh, so I think, as I mentioned earlier, many of you have been on boards. And so some of you are on the NAMA board, some of you are on the NNA board. You plan this meeting. You know that as you go to those board meetings, that some people don't do anything on the board, and other people do all the work on the board. So I think some of it has to do with projecting ourselves. I was sitting here thinking, as you were talking, that if I listed all the boards I've been on progressively through my career, I could actually sell myself as a decent board member. I've been on this type of board, I've been on that type of board, and so I'm prepared now for the next step. So, but I don't know how I figured it out. I actually, you'll be surprised to hear, I used to hate to speak in public. I was afraid to speak in public. But you have to get beyond that if you're going to be a teacher. It doesn't work. So, I don't know. I guess it's been something that I've learned over time. And then I've seen that when I do actually speak, it's not terrible. No one throws tomatoes at me. They actually listen. And so that provides more inspiration for doing it more.
So on some of those websites that I shared with you that you can put in your name to volunteer to be a board member, they also have virtual boards where you don't have to even go. And I don't think that's the best way to start your board experience, because I think you need to experience that interaction in person and not through online. Yeah?
Well, I had a teenage boy, but I need a microphone. I think that there's a really important thing that board members need to remember. And any of you who have been on the Board of Nursing know that we sit down for almost a full day, usually. And then after the board members have been on the board for about a year, we sit them down again and we say, okay, so tell us where your questions are, or what is it that you're seeing that is hard to understand. So we can do that kind of thing. But I think the most important thing that I got from what you were saying, Joey, is respect for each other on the board, shown by listening and by giving every board member a chance to be part of the process. And that's really important in our board. We have a wonderful president who makes that happen, but we also have people who sometimes make that difficult. So I would say if you get an opportunity to be on the board, or when you get an opportunity to be on the board, it's really about listening and respecting the other board members, and then owning the decision that the board members make.
Here's a question in the back. I'll do your mic for there. Somebody with their hand raised up
with Nevada State College. I'm a student nurse with the SNA. I was wondering, what's the best way to make yourself available to those you are governing if you are on the board?
I would suggest at this point, and we're going to make your comment, I think we as state action coalitions need to come up with our own process for letting people know if they're interested. And then I think there needs to be someone that kind of coordinates and follows up, because you can have an opportunity to say you're interested and if nobody helps you get to the next level or helps you walk through or work through some of those barriers, you could easily lose you because you don't have you really understand how to get to where you need to be. You gotta see
So I wanted to respond to your comment. As a student nurse myself many years ago, I was very fortunate to have mentors who said, have your homework done. Have that executive white paper written, 1 page, so that when there was an opportunity to serve, you could send it to the right person. And we didn't have email back then, I can assure you. So we had it ready, and we were ready to send it out. And one of those people was, her name was Dr. Florence Downs, who was the editor of the Journal of Nursing Research. She was not with us any longer, University of Pennsylvania she was. So I'm just saying, have that ready. And today with email, you can have it written ready, right? And if you've written a paper for the Student Nurses Association, then have that information. So knowledge, and as it came up by one of the deans here, we have a lot to bring to the table. Our students do, as well as our nurses, and some hospital boards are very interested in the nurses who have experience to be on their boards, and we can do it. And we have shown it throughout the nation. And I'm sure you've done it here too, so thank you.
What I would add, whoops, there we go. Having been on several boards, sometimes we're really excited to be invited to boards, and so we jump right in. But I would caution all of us to think about what you want to invest in. And like what was said really earlier about being really organized as a leader of a board and the responsibility to be able to communicate and get everything organized. Sometimes the board, even when you're invited to be a member, is the first clue. Do they come to you as a member and talk to you about the role, the really organization itself? What is the responsibility of the organization, what you're trying to achieve when you have that one list out there? If you can read something that is even that thorough, it really invites you into something and makes you feel, really clarifies for you about your investment and understanding your individual roles. So am I there as a nurse? Am I there as a leader of an organization? Am I there as a what? And what are they looking for me to do? So I can also then begin to solicit other people's opinions. It's not just my opinion that I bring as a member of the board. Oftentimes you have to do your homework. I like what was talked about with that. But going back to my original point, just make sure that it's worth your investment. It's not just the honor of being invited, but they should feel honored that you're going to accept and then be able to give you all of that information so you understand the time that you're going to put in.
What you didn't see, and I'm going to speak loud, what you didn't see in some of those websites is that a lot of partnerships. And that could be a possibility that you would want to envision, that partnerships, when you really drill down into some of those websites, they have partnerships with lots of organizations to be able to attract and to recruit board members. So I would encourage you to explore that a little bit more. It's certainly something that I'm going to share in Arizona.
One thing that I haven't heard, I've been on several boards too, you do need to know what kind of board you're going to be on. You need to bring your A game. Be ready to roll your sleeves up, but then also, some boards require you to do a get or give. So you have to be real sure about some of these boards, especially when they're writing grants and raising monies, and some of you are looking like, yeah. they will ask you, what is your contribution? It is not just your brain power either. They want to know who can you bring to the table that can help them financially to sustain themselves and those type of things. So you really need to make sure you know, but there's also boards that will pay you for your intellectual property. So there are corporate boards that will pay you.
Question? Anything else? All right. So I have a few announcements. First of all, thank you very much, Joey. We appreciate you